Meow. Congratulations, if you survived the 30-minute video on this book, you deserve a medal. This is going to be a lot snappier. Basically what I want to talk about is Spanish influenza, the effects on Winnipeg in 1918 and 1919, the unobvious. Stay tuned. So the actual spread of influenza was slow at the beginning, but right from the beginning the number of nurses available to provide care was inadequate. So coupled with inadequate numbers of nurses at the beginning, the nature of the work, and the fact it's an airborne influenza, the staggering effect right at the beginning of this influenza outbreak was that it's estimated more than 1/3 of all trained nurses in Winnipeg got flu and couldn't work, or at the beginning. 20% of the nursing students also came down with flu. Now, not surprisingly, those people who nursed children actually came down with it much more frequently. 2/3 of the pediatric nurses came down with flu. Children are pretty bad at containing colds and coughs. So as soon as they recovered from the flu, and oftentimes they were in bed for a week or 3 weeks with this, as soon as they recovered they were put right back into work. And not surprisingly, with one death after another, and in the predominant age group of 20 to 39, this had a harrowing effect. Nurses also died in Winnipeg. They reckon about 7 of them died. But again, we're dealing with a much smaller population than in 2018. Now it quickly escalated. They started to ask for retired nurses, nurses who had married and quit nursing, because at that time you couldn't be a married nurse. Bear in mind, nurses then largely were female, except in psychiatric hospitals. And they asked for people with St. John's first aid courses to come forward. Quickly it became apparent that the nursing shortage was a critical function. And then they gave up on that and they asked for anybody to come forward to volunteer to nurse, and they would give them 4 days training to do so. Again, this was predominantly females that they sought. The males had a specific role. So with the schools closed, but they were paying the teachers, who again are mostly female, they actually got a large number of the teachers to actually become nurses, and a lot of those nurses were community nurses and went into people's homes, providing basic nursing care. But one of the things that's not really known about the Spanish influenza outbreak is that a minority of the patients suffered severe delirium and confusion, and often became unpredictably violent. This is something I don't think people are taking on board for their pandemic plans. Are you able to restrain the strongest member of your household in bed if he or she becomes violent? You do need to think about stuff like that, which will be covered in the pandemic series, I promise. Not surprisingly, the fabric of society was collapsing, and not surprisingly, the people in power were mostly men, and not surprisingly, their focus throughout the whole epidemic was to get business and the economy functioning again. We saw exactly the same thing in SARS. So the access to hospitals was reduced because people didn't trust hospitals, or they didn't want to afford hospitals, or they didn't see hospitals as being there to serve their needs. That's changed in 2018. But I think it's interesting to know the figures. As I've said before, they did not actually ever fill up their beds. They had about 500 beds that eventually set up for influenza cases, and they probably got about 300 of those occupied at any one time. However, on any given day during the peak, they needed an estimated 6,000 beds. Other than the social aspect that people did not trust hospitals back in 1918, the other fact was that all of these voluntary nurses that were floating around and bringing free food and giving hospital care in people's homes also convinced people they didn't need to go to hospital. Once they were so sick they really should be in hospital, by then it was often too late to transport them or do anything realistically to help them. As with SARS in Toronto in 2003, families were barred from visiting. This happened at Toronto General. Very early on we had a family come in who we did a screening on, who said that they hadn't been exposed to the patient when in fact they had lied to us, and we had to send an entire shift home in quarantine for 7 days. So right from that moment Toronto General stopped all visiting. Sunnybrook did not. Sunnybrook allowed people to visit the critically ill, which are the last people that should be being visited by visitors in a pandemic. One of the issues you might find you're dealing with is actually lack of nurses because they're all sick or staying at home, and also the doctors. The interns in Winnipeg, the trainee doctors, they actually decided to take advantage of this. Now, one of them got infected, so what happened was 3 of the 14 interns actually stopped working immediately, and 2 of them also then later on resigned. So even without the effects of the flu, Winnipeg lost 5 of its 14 doctors that would work at that time. And during SARS we had many doctors who refused to come into the hospital, or if they did, refused to leave their own offices. So when people were transported to the hospital, they were in advanced cases of septicemia and respiratory distress. And mostly, not surprisingly, they died within 5 minutes to 8 hours of admission to the hospital. Hospital basically was somewhere you put somebody just before they died. And I think we may well see that happening again in a massive pandemic. Funerals. They ran out of coffins. Funeral directors started to crank the prices up. The average decent funeral was $135 to $165 at that time in Winnipeg. The prices hit over $900 for a funeral. And that's something you might want to take on board. If funeral service is still available, you're going to have to pay for them. Funerals in the modern age are incredibly expensive. If 2 or 3 of your family are dead and you have to pay for the funeral costs, you might be struggling financially. Not a pleasant thought, but we are preppers, so we look at the unpleasant as well as the pleasant. So not surprisingly, hospital services were impacted severely by the flu. I'm talking about direct effects of the flu, not indirect fear-based effects. What else was affected? Well, cost of wood, and most of the homes at that time were coal and wood heated, went through the roof because people didn't want to bring them into Winnipeg. And the demands for home heating had also soared because people weren't going to work, people weren't going to school, people weren't going out, so people needed to heat the house a lot more. So a lot of the people with flu in Winnipeg at this point in time, which were the majority who were poor, actually were trying to keep warm in a house with 1 fire in a room, or no fire for parts of the day. This was a severe issue. If Winnipeg had looked at this, they would have actually done something about this, and it would have helped. But who else was affected? Strangely enough, the telephone girls, people used to make plugs in, 1/4 of them got flu. That completely messed up the phone service for quite some time during the peak of the epidemic. The other areas that got hit were, not surprisingly, those that contact the public, the police, fire services, ambulances. In the modern age, until they were closed, that would be wait staff, right? Shop girls, shop boys, all of those people who interact with the public on a frequent basis, bus drivers, okay? They all got large amounts of flu, and those services were seriously impacted. In fact, even the National Rail Service lost about 1/4 of its workers to flu at the peak of the epidemic, severely impacting the ability to move stuff across Canada. Again, supply chain collapse is a real thing. It only lasted a week or 2 and bounced back quickly. No guarantee it'll only last a week or 2. Not counted in the death rate of children as the number of miscarriages. A lot of the women that had flu miscarried who were pregnant, and I think that's something that we would see. So that's also going to be an emotional as well as a physical and a cost impact on you. People who are pregnant who catch flu have got a much higher chance of miscarriage. During SARS, Toronto General and Sunnybrook treated it differently. Toronto General, any pregnant female nurse or staff member who wished to be off was allowed to go home at the beginning of the outbreak and stayed off for the entire outbreak, and I think that was good. Sunnybrook didn't do that. Again, each individual hospital in a public-private system like Canada and America have are going to react differently. The advantages of a hospital service like the United Kingdom's National Health Service is that at least the care in each hospital will be pretty standard. This book's a bit dry and you may not enjoy it so much, and it is also from a radical feminist Marxist perspective in places, which I have spared you. But what's going on in elsewhere, right? This is Winnipeg. So they talk about a lady who went to Brandon initially and then went to Montreal, and she actually gets flu but actually recovers. And they give excerpts of her speeches, her letters that she wrote home. You see, I started this letter in Brandon, I'm finishing it here in Montreal. Got here on Saturday afternoon, and today Sunday is raining hard all day. The Spanish influenza is very bad here. People are dying in the hundreds. I have come down here at a very bad time. Willie is not up to the mark and he's been in bed all day. I hope he'll be alright soon. There has been a lot of sickness here, and the deaths are as much as 200 a day from Spanish flu. Everything is shut down here. None of them can go to school or a private school until the sickness is over. People try different medications like Vicks Vapor Rub and camphor oils and eucalyptus oil. People tried pretty much anything they could find. So if you have herbal medicines that you feel might help you with a respiratory infection, I would stock up on them. The price is more than doubled, and often the supply ran out quite early on of things like that. One of the interesting things at Winnipeg at that time, it was prohibition. So there was no alcohol available. And actually the physician group said, look, we need alcohol. Alcohol is actually a good treatment for flu. Now whether alcohol is a good treatment for flu or not is kind of irrelevant, but they recognised it as a medically recognised thing to give people who had flu. But they weren't able to give it because of prohibition. So any medications that were available that had alcohol in them actually sold out quite quickly and disappeared from the shelves. Interestingly, for the children who survived, who had mothers die during the epidemic, they had a mortality rate 4 times higher than children whose mothers had survived. This shows how impacting social determinants of health are on your ability both to survive an epidemic and also the sequelae of it years later. So Winnipeg did quarantining and masking and some degree of placarding and some degree of hospital admission, almost entirely on a voluntary basis. Informing the public, asking them to do this, asking them to do that, relying on the public to comply. Alberta did it a bit differently. Alberta made people go into quarantine and made them report and shut down a whole bunch of stuff. Now Winnipeg shut stuff down much longer than Alberta did. But I think this is one of the interesting things here, is that Alberta made the wearing of masks in public compulsory. The mask order, which lasted almost a month in Alberta, had no apparent effect upon the increasing number of flu cases. Public confidence in it as prevention soon gave place to ridicule. And that's true. Masks need to be N95. You need to know how to put them on and take them off and how to use them. They're not just you put it on and you're okay. So I hope you enjoyed that. I enjoyed reading this book. I also have another book to read about the psychology of pandemics, which I'm going to get into and maybe do at some point. So yeah, stay tuned. The pandemic series is going to go every Tuesday, probably for at least until through June. And during the pandemic series, I'll actually show how I treat both quarantining and supplies and also nursing care of people who get infected. And it will be done not as an infomercial with a bit of textuality around it, but it'll be done in real, as if it's actually happening. So I hope you enjoy that. I hope we never need to use this stuff. But remember, in SHTF, tomorrow will always be worse than today unless you prepare. Toodles.